Hello and welcome to East African Voices. I'm your host, Laban Clifford Serio, right here in Nairobi. In the last 10 episodes of East African Voices, we've focused on the economical aspects that will aid in the integration of the community. We now shift gears and look at the social aspects, focusing on health and education being the two sectors that bring about inequality in East Africa.
The world's view of Africa is that of a continent slowly rising to an economic powerhouse status. 6 of the world's 10 fastest growing economies in the world are from Africa. On the other hand, despite the exciting outlook, the over 1 billion Africans struggle with inequality in access to quality education and healthcare. The positive economic prospect in Africa is not sustainable unless governments promote inclusiveness in all sectors, especially in the poorest nations.
We are one of the world's youngest regions with the fastest growing populations. So the rates of growth that we're talking about of Tanzania is not bad at 7%. It's still not enough to create the jobs and to improve the welfare and to raise the incomes of people to be above a certain minimum. And countries like Rwanda, Burundi, and Kenya have larger proportions of their populations living below their own poverty lines. So we've got to grow faster, bottom line. We've got to grow faster. We've got to grow much more equitably so that the fruits of this growth are spread out.
So what is the state of inequality in East Africa and how is it measured?
There are 2 types of inequality really, and the inequality that people tend to see most obviously visible is the inequality in people's lifestyles or consumptions, which is a reflection of the inequality in income, what they're earning and what is made up of those earnings. But underlying even that further are the inequalities in opportunities, whether to your inequality in terms of the health or the education or even the location or gender or disability. All of these things have an impact in your or in one's ability to earn an income, a decent income or not, and therefore live a decent life. Or not, or a life of excess.
Starting with education, over time the quality of education has come into question due to the methodology employed in passing on knowledge. The State of East Africa report notes that educational levels are mainly distributed by the differences in income which come into play when citizens choose what form and level of education to go for.
And here the disparity, more interestingly, was between countries in terms of the quality of infrastructure for primary schools, the attendance by teachers in school, and the amount of time devoted to teaching children in primary schools. And just to give you, sort of an example, the disparity between Kenya and Uganda and Tanzania. In Tanzania, when the statistics look at it, they call it the social development indicators, showed that only 8% of Tanzania's urban schools had any proper sanitation infrastructure, clean water and good toilets for children to use, compared to over 60% in Kenya and Uganda. Uganda slightly less, about 55%. Rural and urban in those countries had much better sanitation facilities.
The report notes that Burundi is the worst country in the region when it comes to matters of provision of education, with 41% of the men in that country having not attended schools at all, while Uganda tops with 20% of the men having attended no school.
Ukiangalia kama Nigeria unaweza kuta mtu wa kawaida tu yuko sokoni anauza nyanya na nini, lakini utakuta ana degree, ana masters, ana nini, lakini utakuta anafanya kazi za kawaida kwa sababu ile elimu kwao ni kama chakula. Yaani elimu kila mwananchi kwamba anaipata na elimu kubwa. Alafu kwenye swala la shughuli sasa mwenyewe ile elimu aliyoipata sasa ndo anaitumia kutafuta shughuli za kufanya. Sio kwamba serikali impatie kazi. Serikali inajitahidi sana kwa mambo ya kielimu, alafu wao wanakwenda kufanya shughuli zingine za kujitolea.
Perhaps the true picture of inequality in East Africa is best displayed on the ground as it came to light during our visit in Tanzania.
Kuna nchi ambazo kielimu ziko juu, kwa mfano kuchukulia Kenya na Tanzania ni nchi mbili tofauti. Unakuta elimu ya Kenya iko juu. Kwa hiyo changamoto ni kwamba kuna uwezekano mkubwa wa nchi kama ambazo elimu yake iko chini kama Tanzania na Kongo na nchi zingine, watu wakakosa ajira. Watu wakawa wanachukua, most of them wakawa wanachukua wanafunzi kutoka Nairobi.
We have experimented, and I think people need to have courage to do that. Yes, when we opened our borders, when we did that with Kenya, for example, allowing people to move freely between Kenya and Rwanda, and reduced restrictions on work permits and so on and so forth, and visas and so on, everyone benefited. And this is why I was saying Rwanda, we can tell the story. We have benefited. The worries that people had, of course, some Rwandans had worries, but it is up to leaders to, make decisions, but also involve the people.
To aid in bridging the disparity in educational levels and training facilities, the cross-movement of students across East Africa will aid in reducing the educational inequality, especially through knowledge sharing.
We have a very young population on average, and it is indeed a dividend, it is an attribute. But we need that young population to be also able to move freely. We need our youth to be able to move freely within the region. If someone considers that, well, they need to go to school in Kenya, that should be made easier, and that has become easier because now students can move with their ID.
Mimi ni mwanafunzi ku Unirake University. Kwa wanafunzi wenzangu, Mashuri alipatikana juu ya Afrika ya Mashariki. Laha imepanda, vitu yote imepanda juu ya Afrika Mashariki.
They should be able to access any form of education they want anywhere in the region. So we are encouraging our universities to charge the same rates of fees for students coming from within the region. So we don't, in the education sector, we don't consider students from the partner states as foreign if they come to study to a university in one of the countries.
A trend that has caught the attention of policy players who are now willing to enhance this movement by introducing favorable educational policies.
Wajaribu kubadilisha mfumo wa elimu ambao utaendana na mazingira. Umeona? Ukichukulia kwa mfano kama nchi yetu ya Tanzania, unakuta mfumo wetu wa elimu inachukua long process mpaka mtu kuja kufia kwenye highest level. Na kati Kenya mfumo wa elimu ni mzuri ambao mtu anaweza kusoma kwa muda mfupi na akawa na uwezo mkubwa sana kufanya kazi.
At the East African community level, we focus more on higher education. Secondary education, tertiary education, university education, and we do have a specialized institution, the East African the Inter-University Council for East Africa, bringing together the higher education experts within the region, the university chancellors together to discuss on issues of curriculum, issues of fees, issues of quality of services at the higher education level, and employability of our graduates. How do we ensure that our graduates actually study and they are employable? It's not a question of having universities here, graduating people so many every year. What do they go and do? So they should be employable.
We do need that kind of cross-fertilization of talent across the region. Otherwise, all you are integrating goods and maybe services and funds, but the ultimate object of integration, the human, is not being integrated, and that seems to me to be a massively poor strategic outcome of this effort.
Over and above accessibility comes the issue of a quality educational system. Recent inculcation of ICT in teaching and training is expected to enhance the development of education in East Africa. Making strides on this front is Rwanda. We set out to Rwanda's National Library to meet a few students there.
My name is Ketia Eliza. I go to the Belgium school and I have 10 years old.
My name is Cheris Ketia. I study at the Park Don Bosco. I have 11 years old.
Rwanda's midterm target, as underpinned in its Vision 2020 blueprint, is to move from an agriculture-based economy to a knowledge-based economy, and at the heart of it all is ICT. This is underpinned by the launch of the One Laptop Per Child project, which aims at distributing over 500,000 laptops in the next 3 years.
The idea of the One Laptop Per Child is not to keep the same classic education that we've had so far. The idea of bringing technology in education is to provide to our students 21st century skills, and around it we're talking about critical thinking, we're talking about problem solving, we're talking about being able to learn or do projects in groups. We are talking about being able to understand the basics of the usage of a computer, how it works, but also fundamentally to enable the students to learn logics, mathematics, science through programming.
These students have developed a strong passion for ICT skills ever since the government introduced the One Laptop Per Child project.
My favorite subject is computer because I love to scratch on it and so many other things. When I grow up, I want to be a doctor because my father is a doctor.
It is remembered that Kenya too is on a charm offensive to overseas countries to get the best deals for the One Laptop Per Child project.
Many Kenyans, ladies and gentlemen, may think that integration of ICT in primary schools in Kenya has been abandoned. But I want to assure you, Kenyans, that the government is still on course to fulfilling the pledge it made in regard to this important project. I wish to note that the ministry is continuing with consultations and dialogue with various stakeholders and benchmarking with other countries that have successfully implemented the same, so as to develop an implementation model that will be self-sustaining. We have visited Brazil, we've been to Uruguay, we know other countries, Nigeria, Indonesia, other countries have implemented this.
We believe that the focus should not be on procurement. We really think that government should make strategic decision on how to get these laptops and ensure that we do not make this exercise only a procurement exercise. And we believe that if we approach this program as an East African community, we'll be able not only to leverage in terms of numbers, but also in terms of cost. And we'll be able to leverage from knowledge that we can share. So really, the focus should move away from supply and focus on education and see at the community level, East African level, how can we source from the same place.
The rollout of this has, however, raised questions on what exactly would aid in improving the educational landscape in that country and East Africa in general, seeing that as the sector is currently embroiled in a teacher strike that has the teachers demanding over 150% pay increase.
I have to advise them because our government is very good for us. Put the libraries to take children at school in order to know computers. I would advise them to come here and show them the way to come here, and they run together with us.
And that's it for the first half, where we focused on the state of education in East Africa. We're now taking a commercial break. When we return, we travel to Uganda's Mulago Hospital, where we set the stage for the state of healthcare in East Africa. Welcome back. Back in the 1970s, Mulago Hospital was East Africa's largest referral hospital, but since then the hospital has lost its luster due to underinvestment in the healthcare sector compared to investments in other economic drivers.
During our visit to the hospital, we could tell of the people's dire need of medication and assistance, painting a picture of East Africa's deficit of not just medicine, but extra hands of health professionals.
If Kenyan doctors or engineers come and work here, do we need engineers? Do we need doctors here in Rwanda? And they would say, yes, we need engineers, we need doctors. I said, where are they on the Rwandan market? And I would ask the doctor and say, do you really worry that some doctor from Kenya is going to come and take your job? No, he will actually fill the other gap that exists of the work you can't do, because one doctor serving tens of thousands of people, you simply don't serve them well.
Even with the dilapidated infrastructure or the lack thereof, there is still a glimmer of hope. In our visit, we met Robert. He is a patient who has been attending various clinics at Mulago Hospital.
I'm studying from Makerere University, doing Bachelor's of Library and Information Science. Here too. I've come here to get treatment. I got a hypoglycemia attack and I'm diabetic. I was diagnosed with diabetes since 1995 when I was 3 years of age.
Despite the infrastructural and manpower challenge experienced at the hospital, Robert has been able to access healthcare for free.
So hospitals are good, private hospitals are good, but also public hospitals are good in whatever condition they might be, because that's where we have most of the experienced doctors. Many people think the private hospitals may have services, good what, but the experience and the care these people show us, because many people go to those private hospitals, but they end up coming back to public hospitals because the other hospitals can't handle. So they keep on coming back. And for me, I'm proud of the hospital. I'm proud of it.
Robert's condition and that of the entire hospital is a replica of the state of healthcare in other regional countries.
We were looking, for example, at the health sector. When we look at the challenge, for example, of providing hospital beds, we are still importing hospital beds, for example. And yet we have a huge capacity to develop our skills in our Juakali centers and actually pass that business on and create new businesses that supplement these hospitals.
The 2013 Inequality report notes that
health is an asset you carry with you for your entire life. And here we found that the disparity between the rich and the poor in terms of malnutrition, and a great indicator of one's healthy life going forward, is the malnutrition, or your height for age at a particular part of your life. And these are the first 1,000 days of one's life, the first 3 to 4 years. And we found that the rate of malnutrition amongst the poor was much higher than the rate of malnutrition amongst richer kids. In countries such as Burundi and Rwanda, that difference was quite stark. So if somebody is already malnourished, what happens is that it has a negative effect on their intellectual, mental, cognitive development, which means that they will have more trouble in school, learning and retaining. They will do worse in exams. They'll be smaller in size. They'll tend to be more sickly, more prone to diseases and infections. And so for the rest of their life, it will affect negatively their earning ability over the entire adult life. And sadly, you pass it on to your children and to your children. So this becomes an intergenerational negative impact that one is having.
For the past years, now something like 3-4 years ago, I've been getting challenges. But before those 3-4 years, I was well off. I couldn't get any challenge. If at all drugs were a bit scarce, my parents could purchase for me. But now I am economically challenged, such that I can't go on with my diet as I used to.
It's no doubt that Burundi falls short in health rankings due to its uprising from war 20 years ago.
Comment est organisé le système de santé au niveau du pays? C'est-à-dire le système de santé est du système pyramidal. Il est organisé à 3 niveaux. C'est-à-dire il y a le niveau central, il y a le niveau intermédiaire et puis il y a le niveau périphérique.
That said, the efforts to make healthcare affordable and accessible is not only concentrated in central Burundi.
Nous avons des hôpitaux de référence, ils sont au nombre de 5, mais nous avons aussi des hôpitaux de district, ils sont au nombre à peu près 45, mais nous avons aussi des hôpitaux au niveau des provinces aussi qui servent comme des hôpitaux de première référence.
A borderless East Africa has also provided for the movement of people who also look towards accessing medical facilities within the region, slowly ushering in the era of medical tourism in East Africa. In any society, the role women play in nation building is of immeasurable value. This includes aiding ongoing integration efforts.
Initially, gender issues did not have a clear space within the East African integration process, but we now have the social development framework and the policy on gender in the region. We also have now the sectoral council specifically on gender. It used to be amorphous, but now we have a specific sectoral council where we do get the stakeholders on gender issues together.
Whether there's 1 or 2 women in that, listen to the voice, and especially when as the issues you're talking about on childcare and health matters, where women may have more experience, more knowledge because of the impact that has on their own lives. And those are the voices we want to hear, and we hope can be heard and the issues addressed, just because they're the players in that field more. And so for me, when I see women especially playing that role, when I see the First Lady running and saying, I'm going to ensure that no child dies, no mother dies giving birth, because she's a mother herself, she understands. And I think those are the opportunities I'm saying. For me as a woman, I say, what are the opportunities that are there that I can play as a woman or play as a leader? I think half the time is also not to look at yourself as a woman, but it's to say, I have talent, I have skills, and there are opportunities. So be there, play them. And where you have more experience, because maybe they affect women more than men, then let's get into them.
These fundamental skills that are given to our students in a ludic environment, it's playful for them that do not understand the concept yet that they are working on. It's really giving them skills that will enable them to compete tomorrow.
For these young people to be able to receive affordable and quality education, or for ailing Robert to receive adequate healthcare, it boils down to how the leaders are strengthening economic growth by ensuring health and education are prioritized in the developmental agenda.
The objective at the end of it all is to ensure that the region moves as a bloc towards achievement of the Millennium Development Goals in a move that will bridge inequality in East Africa. That's why we leave it at on a look at inequality in the region. As always, we value your feedback and we'd love to hear from you. Find us through our social media pages displayed on your screen, or feel free to email us. Our email address is on your screen. On behalf of the team that made this production possible, from me right here in Nairobi, till same time next week, it's goodbye.